In this video, we're going to walk through systemic lupus erythematosus step by step, starting with what it is, then diving into the pathophysiology, signs and symptoms, diagnosis, and treatment. Systemic lupus erythematosus, or SLE, is a chronic autoimmune disease that can affect multiple organ systems. It is driven by immune complex-mediated inflammation, meaning the immune system produces antibodies that target the body's own tissues. The disease typically follows a relapsing and remitting course, with periods of flares and periods of stability. Severity can range from mild skin and joint symptoms to life-threatening kidney or central nervous system involvement. Now let's talk about the pathophysiology. In lupus, the immune system loses the ability to recognize the body's own tissues as self. Normally, the immune system is trained not to attack the body's own cells. In lupus, that control breaks down. As a result, the body produces autoantibodies, including ANA, and more specific antibodies such as anti-double-stranded, DNA, and anti-Smith. These antibodies bind to normal cellular material and form immune complexes. Those immune complexes circulate and deposit in tissues, where they trigger inflammation through activation of the complement system. Over time, this inflammation leads to organ damage, particularly in the kidneys, skin, joints, and blood. Symptoms of lupus are highly variable and can involve multiple organ systems. Constitutional symptoms, such as fatigue and low-grade fever, are common. Muscle and joint involvement typically presents as inflammatory arthritis that is symmetric and non-erosive. Mucocutaneous findings include the classic malar rash, often referred to as the butterfly rash, which characteristically spares the nasolabial folds. Other findings include photosensitivity, painless oral ulcers, and non-scarring alopecia. Renal involvement may present with hematuria, proteinuria, edema, or hypertension. Neuropsychiatric symptoms, such as seizures or stroke, are less common but potentially serious. Hematologic abnormalities, including anemia, leukopenia, and thrombocytopenia, are also frequently seen. The diagnosis of lupus begins with clinical suspicion based on symptoms and exam findings. Initial evaluation should include a CBC, metabolic panel to assess renal function, urinalysis, and an ANA test. ANA is a screening test and is highly sensitive but not specific. If ANA is positive and suspicion remains high, more specific testing such as anti-double-stranded DNA, anti-Smith antibodies, complement levels, and inflammatory markers can be ordered. Importantly, lupus is a clinical diagnosis supported by laboratory findings. No single test confirms it. Treatment depends on disease, severity, and organ involvement. Hydroxychloroquine is recommended for most patients with lupus and is considered foundational therapy, as it reduces flares and improves long-term outcomes. Because of the risk of retinal toxicity, patients should have a baseline eye exam. Annual screening with an ophthalmologist is recommended while taking hydroxychloroquine. NSAIDs may be used for mild joint symptoms. Corticosteroids are often used for acute flares, with the goal of using the lowest effective dose for the shortest duration possible. More advanced immunosuppressive therapies and biologics are typically managed by rheumatology. Supportive care is also important, including sun protection, cardiovascular risk management, vaccination review, and routine monitoring of renal function. Let's recap the key takeaways. Lupus is a multi-system autoimmune disease with a highly variable presentation. ANA is a useful screening test, but diagnosis is clinical and supported by labs. Renal involvement should always be monitored closely. Hydroxychloroquine is foundational therapy for most patients. Early recognition and appropriate referral improve long-term outcomes. I hope you found this video helpful. If you did, please consider subscribing. It really helps support the channel and allows me to continue creating evidence-based medical content like this. Let me know in the comments what topic you'd like to see next.